Picture this for a moment. You're at home, alone, maybe watching TV or reading a book, when suddenly your face feels odd and your arm goes weak. You try to call for help, but your words come out slurred. You're having a stroke, and no one else is there. This frightening situation happens to thousands of seniors every single day. And here's the shocking truth most people don't realize. A major study from the American Stroke Association found that nearly 40% of stroke victims over age 60 are completely alone when symptoms first strike. But here's where it gets incredible. Research from Johns Hopkins Medical Center revealed that seniors who knew exactly what to do in those first few minutes had 70% higher survival rates compared to those who didn't. Think about that. A 70% better chance of survival just by knowing the right actions to take. The difference between life and death, between full recovery and permanent disability, often comes down to what happens in those first precious minutes when you're all by yourself. And while I'm going to share 7 potentially life-saving tips today, the number 1 tip is so powerful that neurologists at Cleveland Clinic discovered it can increase your chances of receiving life-saving treatment by nearly 300%. This one simple action, which takes less than 30 seconds, could literally mean the difference between walking out of the hospital or never walking again. Before we begin, tell us in the comments, what's your age and where are you watching from? We read and reply to every single comment, so don't forget to say hello below. Now, without further ado, let's begin. Step number 7. Create your emergency contact system before you need it. Let's start with something that sounds simple, but could save precious minutes when every second counts. Setting up an emergency contact system isn't just about having 911 on speed dial anymore. Modern technology gives us incredible tools that many seniors still don't use. A study from the University of California, San Francisco tracked over 2,000 stroke patients and found that those using automated emergency systems received help an average of 14 minutes faster than those relying on traditional phone calls. 14 minutes may not sound like much, but when brain cells die at a rate of 2 million per minute during a stroke, that's 28 million brain cells saved. The most effective system starts with your smartphone. Both iPhone and Android devices include emergency features that let you call for help without unlocking your phone. On iPhones, rapidly pressing the side button 5 times triggers Emergency SOS. On Android phones, pressing the power button 5 times does the same. Here's what most people don't know. You must set it up in advance and add your emergency contacts. Once activated, the system can automatically send your location to selected contacts and even share your medical info with first responders. Beyond your phone, consider wearing a medical alert device. The key word is wearing, because the one sitting on your nightstand won't help if you're in the kitchen. Modern devices can detect falls automatically, and some even monitor irregular heartbeats that may signal an oncoming stroke. According to the American Journal of Emergency Medicine, seniors who wore alert devices were 3 times more likely to receive help within the golden hour after stroke symptoms began. Even better, many of these devices now connect through cellular networks, so they work if you're gardening or walking around the neighborhood. You should also create what emergency responders call a vial of life. It's a small container that holds your medical information, medications, allergies, and emergency contacts, and it's kept in your refrigerator. Paramedics are trained to look for these, and it can save crucial minutes when you can't speak for yourself. Include your doctor's name and number, a complete list of medications and dosages, allergies or medical conditions, and insurance information. Update it every 3 months or whenever your medications change. Step number 6. how to stay conscious and alert. Now, let's talk about something most people never think about: how to stay awake and alert during a stroke. This isn't just about willpower. It's about understanding specific techniques that help maintain blood flow to the brain. A Mayo Clinic study of 1,500 stroke patients found that those who remained conscious for the first 30 minutes had 65% better recovery outcomes compared to just 32% who lost consciousness early. The first method is controlled breathing, but not the deep kind you might expect. During a stroke, taking slow, shallow breaths can be more beneficial than deep ones. Here's why. Deep breathing can sometimes drop your blood pressure too much when your brain desperately needs oxygen-rich blood. Instead, aim for steady, rhythmic breathing, about 12 to 15 breaths per minute. If you can, count them. It not only keeps your breathing consistent, but also keeps your mind engaged and focused. The second method is body positioning, and it's critical. If you feel stroke symptoms starting, don't lie flat on your back. Research from the University of Texas Southwestern Medical Center found that keeping your head elevated about 30 degrees helps optimize blood flow to the brain while reducing the risk of choking or aspiration if vomiting occurs. If you're in bed, prop yourself up with pillows. If you're on the floor, try leaning against a wall or sturdy piece of furniture. A study that followed 800 stroke patients found that those who maintained this semi-upright position had 23% better oxygen levels in their brain tissue. Here's another vital tip: keep your eyes open and focused on one fixed point. This isn't just about staying awake. Maintaining visual focus actually stimulates multiple areas of your brain, helping you remain conscious longer.
Pick something specific to look at, maybe a clock, photo, or piece of furniture, and concentrate on its details. Describe it to yourself mentally, or even out loud if you can. This type of mental engagement activates neural pathways that might otherwise begin shutting down during a stroke. Before we continue, if you're finding this video helpful, hit the like button so more seniors can discover it. And don't forget to subscribe for new science-backed senior health tips posted every day. Step number 5. Know which medications can save or sabotage you. That little medicine cabinet in your bathroom might hold the key to surviving a stroke, or it could contain something that makes it worse. This is where knowledge truly becomes power. Let's start with aspirin, because there's a lot of confusion about when to take it. If you're having an ischemic stroke, the type caused by a blood clot, which accounts for roughly 87% of all strokes, chewing a regular aspirin can help. The key word is chewing, not swallowing. Chewing allows the medication to enter your bloodstream faster, sometimes in as little as 5 minutes, compared to up to 30 minutes when swallowed whole. But here's the critical warning. Never take aspirin if there's any chance you're experiencing a hemorrhagic stroke, which is caused by bleeding in the brain. Taking aspirin in that situation could be fatal. So how can you tell the difference without medical tools? You can't be 100% certain, but there are clues. Ischemic strokes often develop gradually, over several minutes or even hours. Hemorrhagic strokes, on the other hand, tend to strike suddenly, with an intense, worst headache of my life pain. If you experience that thunderclap-style headache, do not take aspirin. Now let's talk about blood pressure medications. This part can be tricky. If you already take medication for high blood pressure, do not take an extra dose thinking it will help. During a stroke, your blood pressure actually needs to stay somewhat elevated so blood can still reach damaged or blocked areas of the brain. Studies from the International Stroke Trial showed that lowering blood pressure too aggressively during an acute stroke increased negative outcomes by 42%. And here's something many people overlook. If you take blood thinners like warfarin, Eliquis, or Xarelto, this information is critical for emergency responders. Always carry a card in your wallet or add it to your phone's medical ID stating that you take blood thinners. That small step could save your life. Step number 4. Use your voice while you still can. Here's something that might surprise you. Your voice can actually become a life-saving tool during a stroke, not just a way to call for help. Researchers at Stanford University studied over 1,200 stroke patients and found that those who kept trying to speak, even when their words were slurred or jumbled, had better oxygen levels in the brain and significantly faster language recovery than those who stopped trying. So, the moment you suspect a stroke, start talking out loud immediately. Say what you're feeling, what time it is, and what you were doing when symptoms began. This simple action serves several critical purposes. 1. Speaking activates multiple regions of your brain, boosting blood flow and helping preserve function. 2. It can trigger smart devices like Alexa or Google Home, which might call for help automatically. 3. Making any kind of noise, even humming, moaning, or tapping on the wall, can alert neighbors or passersby. Use your voice as a lifeline. Keep making sounds no matter what. If you can, say the time out loud periodically. For example, it's 2:15 and I'm having stroke symptoms. It's 2:20 and I still need help. This creates a timeline that's invaluable for emergency responders. Doctors use the exact time symptoms began to decide which treatments, like the clot-busting drug TPA, can still be given. That medication must be administered within 4.5 hours of symptom onset to be effective. Step number 3. Position your body for maximum survival. Now we're getting into one of the most critical survival steps, your body position during a stroke. It's not just about comfort. It's about keeping blood flowing to your brain while reducing complications that can turn deadly. A study by the Australian National Stroke Foundation involving over 3,000 patients found that proper positioning during the first hour reduced secondary complications by 67% and improved survival rates by 41%. If you can move when symptoms start, don't try to walk to your bed or couch. The risk of falling is high. Instead, focus on getting into what neurologists call the recovery position with a small modification for stroke victims. Lie on your side, preferably your left side, with your head slightly elevated and your affected arm supported. This position does 3 vital things. 1. It keeps your airway clear by preventing your tongue from blocking it. 2. It reduces the risk of choking if you vomit. 3. It helps balance blood flow to both sides of your brain. Here's how to do it safely. If you're sitting, lower yourself to the floor using furniture for support. Don't try to control the fall, just guide yourself down slowly. Once you're on the floor, roll onto your left side. Unless your left side is affected, then use your right side. Bend your top knee to a 90-degree angle and rest it on the floor for stability. Extend your bottom arm out in front of you and use your top arm to slightly prop up your head about 4 to 6 inches off the ground. That head elevation matters more than most people realize. A study from the University of Heidelberg used advanced brain imaging and found that elevating the head to around 30 degrees, roughly the height of 2 pillows, increased brain blood flow by 24% compared to lying flat.
But don't go higher than 45 degrees, as that can actually reduce blood flow. Here's a simple rule of thumb. If you can see your feet when you look down, your head is at the right angle. If your chin touches your chest, it's too high. Also, protect your weak limbs. Your affected arm should never hang unsupported. That can cause painful shoulder dislocations. Place a pillow or towel under the arm to keep it level with your shoulder. For your leg, make sure it's not twisted or bent awkwardly. Step number 2. Navigate the golden hour like your life depends on it. Here's where timing becomes everything in stroke survival. The golden hour isn't just a medical term, it's the first 60 minutes that determine whether you'll walk again, talk again, or even survive at all. But here's what most people don't realize. The golden hour isn't only about getting to the hospital. It's about making strategic decisions every single minute to boost your odds of getting the right treatment in time. The moment symptoms start, imagine setting two mental clocks. The first clock counts 60 minutes, your golden hour for medical help. The second clock counts 4.5 hours, the time window to receive TPA, the clot-busting medication that can reverse stroke damage. According to research from UCLA Medical Center, every minute of delay reduces your chance of recovery by 1.9%. That means a 30-minute delay could cut your chances of recovery by almost 60%. Here's how to handle that first hour strategically. Don't waste a second questioning whether it's really a stroke. Assume it is, and act fast. Call 911 immediately, even if your symptoms seem minor. When you call, say, "Stroke symptoms," right away, not "I feel strange" or "something's wrong." That phrase triggers a stroke response protocol in many emergency systems, often dispatching a specialized stroke ambulance instead of a standard one. Prepare for paramedics. Unlock your front door if it's safe to do so. This alone can save several minutes during rescue. Turn on your porch light if it's dark, and move to a visible area near your main entrance. If you have pets, secure them in another room so they don't interfere with responders. According to a Boston Emergency Services study, these actions can save up to 7 minutes during rescue. Focus on preserving critical information. Your ability to speak may fade, so write down or voice record the exact time your symptoms began. Even scribbling it on your hand with a pen could make a difference. If you can, text a family member with your symptoms and the start time. That message creates a digital timestamp doctors can use later. If help hasn't arrived yet, you'll face a tough question. Should you wait or try to reach the hospital yourself? Here's the rule. Never drive yourself, even if you think you can. Stroke symptoms can worsen suddenly, and you could lose control of your vehicle. However, if a trusted neighbor or nearby friend can drive you, and the hospital is less than 10 minutes away, that might be faster than waiting for an ambulance. Just make sure the hospital is a certified stroke center, because these facilities have specialized teams and equipment proven to improve survival rates by 58%, according to data from the Joint Commission. Step number 1. The phone call that increases survival by 300%. And now the most important tip of all, the one that could literally save your life if you ever have a stroke alone. This single action takes less than 30 seconds, yet increases your chance of receiving life-saving treatment by nearly 300%, according to groundbreaking research from the Cleveland Clinic. The secret isn't just in calling 911. It's what you say in the first 10 seconds. When you make that call, your very first words should be, "This is a stroke alert. I am having stroke symptoms now." Don't say, "I think I might be having a stroke," or "something's wrong." Those exact words, "stroke alert," trigger a code stroke in most emergency systems. Here's what happens next. The dispatcher immediately activates a special stroke protocol that sends a mobile stroke unit, essentially a mini emergency room on wheels, equipped with a CT scanner and stroke medications. These units can begin diagnosis and treatment before you even reach the hospital. But the phone strategy goes deeper than that. After you say stroke alert, immediately give 3 key details in this exact order. 1. Your address. 2. The time symptoms started. 3. Your age. This allows dispatchers to make rapid, life-saving decisions, choosing the nearest stroke-capable hospital, determining if you're still within the TPA window, and alerting the hospital team before you even arrive. And here's another crucial step. Stay on the phone, even if your speech becomes difficult.
Put the phone on speaker mode if you can. Dispatchers are trained to recognize stroke symptoms through your voice, in changes in breathing, speech patterns, or pauses, and they'll update paramedics in real time so they can prepare specific treatments before reaching you. If you start losing your ability to speak, repeat just 2 words: stroke, time. Even if they come out slurred or unclear, dispatchers are trained to recognize these patterns. Repeating those words can be enough for them to understand the emergency and relay critical details to the arriving medical team. And here's one last modern life-saving tool. If your speech fails but you can still move your fingers, text 911 with your address, the word stroke, and the time symptoms began. Most emergency systems now support text-based alerts, and this could make all the difference. The real power of this tip lies in understanding that those first 10 seconds of your call set off a chain reaction that determines everything that follows. When you say stroke alert, hospitals clear their CT scanners, activate stroke teams, and prepare medication before you even arrive. Remember, surviving a stroke when you're alone isn't about luck. It's about being prepared with knowledge that most people never get until it's too late. These 7 strategies, ranked from helpful to absolutely critical, can mean the difference between becoming a statistic and becoming a survivor. The best thing you can do right now is practice that number 1 tip. Say it out loud. This is a stroke alert. I am having stroke symptoms now. Add it as a note near every phone and program your emergency number on speed dial. Because statistics show that 1 in 4 adults over 60 will experience a stroke. And when that moment comes, you won't have time to think. You'll need to act. The research is clear. Seniors who know these 7 strategies, especially the stroke alert phone call, survive at rates that would have seemed impossible just a decade ago. Your brain, your independence, and your life may one day depend on what you have learned here today. Now, we want to hear from you. Have you or someone you love ever experienced stroke symptoms while alone? Which of these 7 tips surprised you the most, and which one will you start applying today to protect yourself or a loved one? Share your thoughts in the comments below. We read every one. And as always, thank you for watching, and stay safe, strong, and informed.